major changes coming in 2025. Whether you're on original Medicare with Medigap and Part D or a Medicare Advantage plan, and welcome back to Preferred Medicare. I'm Holly Cohen, your Medicare expert, licensed agent, independent broker. Over the years, I've guided thousands of people through Medicare, and today I'm actually breaking down the major changes coming in 2025. Whether you're on original Medicare with Medigap and Part D or a Medicare Advantage plan, these updates are important for you. So stay tuned. So let's start with a quick overview of your Medicare options. Original Medicare with Medigap allows you to see any doctor nationwide who accepts your Medicare card. Medicare Advantage. This plan bundles a Part A, Part B, and Part D many times with a few other benefits such as dental and vision. It is a replacement for your federal Medicare, and it does require you to use a network of doctors. If you go out of network on a PPO plan, you can do so, but many times it may not be covered, or you're going to have much higher out-of-pocket costs when it's Medicare Advantage. Here's what's changing in 2025 and how it will affect you. A $2,000 annual pocket cap for Part D will be introduced for 2025, starting on January 1st. This cap will offer major relief with the high-cost medications. Now let's talk about the coverage gap, previously known as the donut hole. It will be completely eliminated in 2025, which means you're not going to be cut off at a certain point paying for your medications. There's no more coverage gap. $2,000 max is the most you're going to pay for the entire year for medications. You'll be able to manage out-of-pocket costs with monthly payments. That will be another option for 2025, making it easier to budget and avoiding the large pharmacy bills when you go pick up prescriptions at the pharmacy. Medicare has begun the price negotiations directly with the manufacturers because of the Inflation Reduction Act. The drugs that will be lowered in cost that were just up for price negotiations will start for 2026 to have lower costs are the following: Eliquis, Jardiance, Xarelto, Januvia, Forxiga, Entresto, Enbrel, Imbruvica, Stelara, and lastly, a lot of the diabetic ones, such as FlexTouch and Novolog, any of the pens or pen fills. So for 2025, those 10 drugs I just listed will not be lowered, but the cap of $2,000 will begin January 1st of 2025. And then those drugs I just mentioned will be coming down for 2026. In the long term, insulin-dependent diabetics and many other people who have to pay a lot for medications, such as cancer drugs and some of the other medications I just mentioned that are for some autoimmune disorders and rheumatoid arthritis and other things that have been traditionally so expensive for Medicare beneficiaries, is now going to at least have some reprieve so that they won't be spending more than $2,000 next year. And then the year after, those 10 medications have been negotiated down for 2026. And then that again will happen next year, and that will continue on. That every year, 10 more medications will be lowered based on what passed in 2022 for the Inflation Reduction Act. Another good thing that's happening starting next year is spreading that $2,000, that out-of-pocket cost. You will be able to manage the out-of-pocket cost on your prescriptions, and you'll be able to go on a monthly payment plan, making it easier for you to budget and avoiding a very large deductible when you first go to pick up a prescription. Now let's shift gears for just a moment and let's talk about the Medicare supplement plans, also known as Medigap plans. What we have seen, and we're licensed across the country, is that prices have been bumping up in the last few months for Medicare supplement plans. There's lots of reasons for this. One reason is there had been pent-up demand to have treatments that had previously been put off due to COVID. Those we've now seen the last couple of years an after effect of, and it's bumped up the claims that Medicare has had to pay for these patients that have decided, of course, to have these surgeries. As a result of that, the Medigap plans are also going up in price for next year. Now, if you currently have a Medigap, a Medicare supplement plan, a Plan F, a Plan G, or a Plan N, I would strongly encourage you and you could do this any time of year, to call your agent, or you can call us even. You can always call us, 855-265-6334. Any agent that represents, or any independent broker, a licensed independent broker who represents multiple carriers for a Medicare supplement plan, for Plan G, will be able, or Plan F or Plan N, will be able to shop across the different companies that they represent to give you a better price. If you're in good health, you are allowed to make a change any time of year, as long as you're approved based on the 26 to 30 health questions that you have to be asked if you already have a Medigap plan in place. But received a price increase on your Medigap plan, you do not have to wait until October 15th through December 7th to make that change. You can call now. If you're in good health, if you don't take too many medications, you can get approved, hopefully for a lower price. It's always important to shop the market on those Medigap plans. And because there had been pent-up demand on delaying some surgeries because of COVID, and we've seen the rising claims, and which rises the premiums in the Medigap plans, if you're one of the healthy people, it is definitely your time to make a change to a lower cost plan. If you're on a Plan F and you're in great health and you're concerned that you won't have the same treatment, I assure you, if you go to a Plan G, you will have the same coverage because it's original Medicare. Your only out-of-pocket cost for the year is $240. So due to increased medical claims and that pent-up demand from the COVID pandemic, many carriers are experiencing a surge in claims, which has led to higher monthly premiums for Medigap plans. Carriers are essentially playing catch-up with the rates. Some have already proactively raised rates. And if you're new to Medicare, do not be afraid to go with a little higher premium carrier. And I'll go over some of the names in just a moment. The more established carriers are going to be the ones that they don't have a crystal ball, but they have a good idea of how these market changes affect them. And the ones that have an A or an A plus rating financially are strong companies such as Mutual of Omaha, Allstate, Globe Life, Cigna. And some people think that because the name Blue Cross, it's going to somehow save them money or get them into some better position. When you're on a Plan G, a Plan F, or a Plan N, it could literally say McDonald's on your Plan F, G, or N card because you're using your red, white, and blue card as your primary. And that secondary Medigap plan, which is defined by a letter F, G, or N, is simply there to pick up the balance. It's a federal law. It has to pay the 20% after original Medicare pays the first 80%. All three of those letters, F, G, and N, pay everything for Part A, all deductibles. F plan pays the deductible in Part B. The G plan doesn't pay it, so you pay the $240 for the year. The N plan, you have the $240 for the year. You have a possible $20 copay at your doctor and a possible $50 copay at an ER, and you are responsible possibly for Part B excess charges on a Plan N. Make sure to watch other videos of mine. I do explain the differences between these three letters. Just bear in mind, the name of the insurance company that is attached to your letter F, your G, or your N is not that important. What's important about that name is that they're a financially strong insurance company, that they have been in the Medicare supplement world for a long time, such as a company like Mutual of Omaha, some of the others as well. Again, with the Blue Cross plans, remember this about a Blue Cross company. There's 36 Blue Cross Blue Shields in the United States, and they're regional. So if you live in, for example, Florida, you're going to have a company called Florida Blue. If you live in Illinois, you're going to be part of Blue Cross Blue Shield of Illinois regional plan. If you live in Michigan, you would be on Blue Cross Blue Shield of Michigan. If you live in California, there's multiple Blue Crosses and Blue Shields in California. If you live in an area where there's Anthem bought a lot of the Blue Crosses. So in other words, the name Blue Cross is a franchised name. When you're paying more for a Medicare supplement, many times you're paying more just because of the name, like a designer. So just be very cautious and understand that when you're doing research, the best person to really talk to is the medical billing person in a hospital. They can always Many times they can tell you who is the fastest payer of these carriers. Anyway, lots of changes coming down the pike for 2025. So stick close to this channel. I'm going to put up as many videos as possible before open enrollment begins to get everyone prepared, because these are some significant times that we are in. That's all for today. As always, please be well.